Chapter 4, Anxiety Disorders, Panic, and Phobias. 4.0 Introduction. This chapter provides a comprehensive exploration of anxiety disorders, including panic attacks and various phobias. It covers the symptoms, clinical features, epidemiology, etiology, and treatment approaches for these disorders, emphasizing the importance of understanding these conditions for effective diagnosis and management. Have 4.1 Objectives. After reading this unit, you will be able to understand the symptoms and clinical features of anxiety disorders, panic attacks, and phobias. Discuss the epidemiology and etiology of these disorders. Explain various treatment approaches for anxiety disorders and phobias. 4.2 Symptoms and clinical features. Anxiety disorders. Anxiety disorders are characterized by excessive fear and anxiety that interfere with daily activities. Common types of anxiety disorders include generalized anxiety disorder, persistent and excessive worry about various aspects of life, often accompanied by physical symptoms such as fatigue, muscle tension, and sleep disturbances. Social anxiety disorder, intense fear of social situations where one might be judged or scrutinized by others. Symptoms include sweating, trembling, and difficulty speaking. Specific phobias, irrational fears of specific objects or situations, such as heights, acrophobia, enclosed spaces, claustrophobia, or spiders, arachnophobia. Exposure to the phobic stimulus often results in immediate anxiety response. Panic attacks. Panic attacks are sudden periods of intense fear or discomfort that peak within minutes. Symptoms include palpitations or accelerated heart rate, sweating, trembling or shaking, shortness of breath or sensations of smothering, chest pain or discomfort, nausea or abdominal distress, dizziness or lightheadedness, chills or heat sensations, paresthesias, numbness or tingling sensations, derealization, feelings of unreality or depersonalization, being detached from oneself, fear of losing control or going crazy, fear of dying, phobias. Phobias involve a persistent, irrational fear of a specific object, situation, or activity, leading to avoidance behavior. Types of phobias include agoraphobia, fear of being in situations where escape might be difficult or help unavailable during a panic attack. It often leads to avoidance of places like open spaces, public transport, or crowded areas. Social phobia, also known as social anxiety disorder, involves intense fear of social interactions and situations where one might be embarrassed or humiliated. Specific phobias, as mentioned earlier, these are fears of specific objects or situations. IGNOU 4.3 Epidemiology and Etiology. Epidemiology. Anxiety disorders are among the most common mental health conditions globally. They often begin in childhood or adolescence and can persist into adulthood if not treated. The prevalence varies by type. Generalized anxiety disorder affects approximately 3 to 4% of the population. Social anxiety disorder affects about 7% of the population. Specific phobias affect about 7 to 9% of the population. Etiology. The causes of anxiety disorders are multifactorial, involving genetic, biological, environmental, and psychological factors. Genetic factors. Family studies suggest a hereditary component with higher concordance rates in identical twins compared to fraternal twins. Biological factors, neurotransmitter imbalances, e.g., serotonin, norepinephrine, GABA, and brain structure abnormalities, e.g., amygdala hyperactivity, play a role in anxiety disorders. Environmental factors, stressful life events, trauma, and adverse childhood experiences contribute to the development of anxiety disorders. Psychological factors, cognitive patterns, such as excessive worry and maladaptive coping strategies, can exacerbate anxiety symptoms. 4.4 Treatment approaches. Cognitive behavioral therapy, CBT, a widely used therapeutic approach that helps individuals identify and change negative thought patterns and behaviors. Techniques include cognitive restructuring, exposure therapy, and relaxation training. Cognitive restructuring involves identifying and challenging irrational or maladaptive thoughts and replacing them with more realistic and adaptive ones. Exposure therapy, gradual exposure to feared objects or situations to reduce anxiety through habituation. Relaxation techniques includes methods like deep breathing, progressive muscle relaxation, and mindfulness meditation to reduce physiological arousal associated with anxiety. Medications. Pharmacological treatments can be effective in managing symptoms of anxiety disorders. Antidepressants, selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed for their anxiolytic effects. Benzodiazepines, effective for short-term relief of acute anxiety symptoms, but carry a risk of dependence and tolerance. Beta blockers, used to manage physical symptoms of anxiety, such as palpitations and tremors, particularly in performance anxiety. Exposure therapy, a specific type of CBT where individuals are gradually exposed to the feared object or situation in a controlled manner, reducing anxiety over time through desensitization. Relaxation techniques, various techniques to manage and reduce anxiety levels. Deep breathing, focused breathing exercises to calm the nervous system. Progressive muscle relaxation, systematic tensing and relaxing of different muscle groups to reduce physical tension. Mindfulness meditation, practices to increase awareness and acceptance of the present moment, reducing stress and anxiety. 4.5. Let Us chapter has provided an overview of anxiety disorders, panic attacks, and phobias, including their symptoms, causes, and treatment options. Understanding these aspects is crucial for effective diagnosis and management. The chapter emphasizes the multifactorial nature of these disorders and the importance of a comprehensive treatment approach that includes both psychological and pharmacological interventions. Main points of Chapter 4: Anxiety disorders, panic, and phobias. 4-point introduction examines anxiety disorders, including panic attacks and various phobias, covering symptoms, clinical features, epidemiology, etiology, and treatment approaches. 4.1 objectives: understand symptoms and clinical features of anxiety disorders, panic attacks, and phobias. Discuss epidemiology and etiology of these disorders. Explain various treatment approaches for anxiety disorders and phobias. 4.2 symptoms and clinical feature anxiety disorders. Excessive fear and anxiety interfering with daily activities. Includes generalized anxiety disorder, GAD, social anxiety disorder, and specific phobias. Panic attacks. Sudden periods of intense fear or discomfort with physical symptoms like palpitations, sweating, and shortness of breath. Phobias. Irrational fears of specific objects or situations leading to avoidance behavior. Includes agoraphobia, claustrophobia, and acrophobia. 4.3. Epidemiology and etiology. Epidemiology. Anxiety disorders are common mental health conditions, often beginning in childhood or adolescence. Etiology. Multifactorial causes involving genetic, biological, environmental, and psychological factors. Includes genetic predispositions, neurotransmitter imbalances, stressful life events, and maladaptive cognitive patterns. 4.4 Treatment approaches. Cognitive behavioral therapy, CBT, helps identify and change negative thought patterns and behaviors. Techniques include cognitive restructuring, exposure therapy, and relaxation training. Medications. Antidepressants, SSRIs, SNRIs, benzodiazepines for short-term relief, and beta blockers for managing physical symptoms. Exposure therapy, gradual exposure to feared objects or situations to reduce anxiety through desensitization. Relaxation techniques, methods like deep breathing, progressive muscle relaxation, and mindfulness meditation to reduce physiological arousal. 4.5 Let Us sum up. Summarizes the overview of anxiety disorders, panic attacks, and phobias, emphasizing the importance of understanding symptoms, causes, and treatment options for effective diagnosis and management.